nice to see you in person. I'm Youjeong Kim, and I want to thank Chol and Kevin for inviting me to give too many talks at this meeting. I'm like very deathly afraid of public speaking, so here we go. And then I also have to present on this topic of marketing, which is completely out of my comfort zone and an area that I had neglected until putting this talk together and found out a lot of eye-opening things. So for those of you that don't know me, I'm a solo practitioner in San Francisco. This past year, after being a renter in a big medical office building for many years, I purchased my own space. I renovated it and moved in. I have 6 full-time staff members, a PA, office manager, a scheduler, 2 medical assistants that do a little bit of scribe and research for me as well, and a biller. And I have about 40 to 50 patient encounters per week, and I do mostly all outpatient MIS surgery cases with very rare inpatients. My referral sources, as probably for most of you, have been primary care providers, followed by chiropractors and physical therapists, previous patients and word of mouth, and then self-referrals. And I've always found that the self-referrals were my most problematic group because they were the most unreliable to actually show up. And they were sometimes the most non-compliant because I didn't have someone overlooking them. They didn't have a family member or a physical therapist or a doctor to hold them accountable. And I completely missed the internet, social media, in the sense that I never had a Facebook account. I don't have a LinkedIn profile, no Instagram, and Twitter, even though it's in my backyard, I just don't participate. I never got into it. So in doing this talk, I came across a couple of interesting stats I wanted to share, because I thought if you were marketing yourself, you're probably an entrepreneur or you're owning your own practice, but it was so much more important for everyone. But here are some stats. 2016 was the first year in which less than half of the physicians that identified and responded to this survey for the AMA had ownership stake in their practice. And 2018 was the first year where there were fewer physician owners compared to physician employees. And so employees would be anywhere from academics to Kaiser systems, and even to these medical practices that are owned by private equity. Between 2012 and 2018, just as I was growing my solo practice, there was this major shift away from solo practice to larger groups. And younger physicians and women physicians, which I identify with, are less likely to be owners than their older and male colleagues. And I believe younger was defined as less than 50, which I still fall into that category. Surgical subspecialties were the highest percentage to be owners, unsurprisingly. So historically, patients had found their providers through their primary care physicians and as a referral, but we are now in a cyber internet era where consumers find everything on the internet, including where to eat, what to wear, where to travel, and who to choose as their doctor. So we just can't ignore the fact that our online internet presence is very important. And when you look at this, there's 2 aspects to being online as a medical provider. You have the online reviews, and then you have your social media personality or reputation. So I wanted to question and poll everyone here. Who here checks your online reviews? Let's just raise your hand.
Personally, or have people?
Yeah, people, anyone who checks them for you, okay? And then who responds to them? Like, so there we go. That's a problem. If you look at this, medicine is a consumer driven platform now. And this survey that was done by Software Advice, and you can argue, well, maybe if you're on this platform and responding to this type of survey, that you are more online than maybe the older and less connected types of patients. But even my parents, who are elderly and not all that internet savvy, when they get healthcare, I'm checking online for whoever they're going to. So in one sense or another, I think even if this number is a bit high, we can't ignore that. So we have to curate our online presence. And 71% of patients use these online reviews as their first step in finding a new doctor. 43% would go out of network and actually pay more money out of pocket for a doctor who has more favorable reviews. And I have a lot of patients who tell me that all the time, that you're not in my network, but I'm still coming to see you. 66% felt that it was important for providers to respond publicly and address complaints head on, because I would have actually thought that it was the opposite. I would have thought that if there is a big rant and rave and you kind of get into it and respond, you come off sounding defensive. But it's the opposite, that patients actually want to see a response from you. And 80% of consumers trust online reviews as much as personal recommendations. So even though they don't know this reviewer, if they say these glowing things or these negative things, they actually think of it as if a friend or an acquaintance had said that same exact review. And unfortunately, only 53% in this audience, much less, it seems like, actually look at the review websites. So simply sticking your head in the sand is no longer an option. I wanted to go over some of the top 10 review sites, and just in the interest of time, we won't go into them in detail. I actually had like a web page for each one, but so there's Yelp. Everyone's heard of that. I was at a party and I met Jeremy Stoppelman, the founder and CEO of Yelp, who is a neighbor to one of my friends. And he said that he came up with the concept of Yelp way back in 2004 because he was sick. He had a little case of the sniffles and he wanted to go see a primary care doctor, but he couldn't choose who to go to. So he actually told me, knowing that I was a healthcare provider, that that's kind of how he first thought of Yelp. There's Google. Everyone does a Google search. They'll say, oh, who is this doctor? Even if a primary care doctor refers them to me, a lot of my patients will come in and say, I searched you up and I know your background. And it sounds a little, off-putting, but they're doing it. There's Facebook. The interesting thing about Facebook is that you can actually post and put videos on and photos and status updates and check-ins as a business. There's WebMD. Their specialty is that they actually provide some informational pages on symptoms and medical conditions so that patients are drawn to this site to check out what their diagnosis is. And they also have a physician directory, and their ratings are a little bit more advanced than just 1 to 5 stars. There's subcategories. And then there's Health Grades, 30 million people per month on their site. Again, a little more advanced on the ratings. There's ratemds.com, Vitals, ZocDoc. This is an app-based service, and patients browse reviews and then they actually book appointments through this app, and they charge doctors to be included on this. And so it's a lot of the younger doctors starting out in private practice, they'll sign up to be on ZocDoc. CareDash is new to the scene. And then Angie's List, it's a membership-based program for household services, but one of their biggest and fastest growing sector would be the healthcare providers. So the good news, though, is that when you look at all the reviews across all the sites, a good majority of them are positive reviews. So when physicians shy away from this online reviews, because a lot of the surveyed physicians actually find that online reviews are a point of stress for them. It's just one more thing for them to worry about on their day-to-day basis of trying to take care of their patients. So there's only 1% that would be very negative, and they're usually the crazos. They're the ones that rant and rave, and maybe they really did truly have a bad experience, but that's not the reason to shy away from really taking control of your online presence. The way to make the reviews as best as they possibly can be, you have to approach it from the patient experience. So even though you may be the best surgeon in town to do whatever that procedure is, you have to be available, and you have to make the appointment, making the appointment easy for the patient. At their first check-in, your receptionist has to be friendly, and has to be a pretty easy check-in process without a long wait. And then it's the patient's perception of your bedside manner. So I say it's their perception, because you can think that you're being very understanding and you sit down, but if they think that you're not listening or you're a little bit cold, then it's really up to their perception. Post-op follow-up visits are equally important. So you shouldn't be really relegating that to your PAs and to medical students or residents if you're in an academic practice. And then this last point is important, because if you maintain a relationship with your patients, they will send you more patients. They will send you their friends, their families, and their surgery would be way, it might have been a few years ago. And the way that you stay connected with your patients is via social media. So then this is the second part, is who has a Facebook account here? Everyone, most everyone, not me, but okay. And then who has a Facebook page for your practice? Just another a few here. So I thought that a lot of you may be in academic practice. So I found this Facebook page of this very academic practice, the UC Davis Cardiothoracic Surgery Group. And they have this nice Facebook page. And I'm sure that they have someone managing it. I'm sure that the individual surgeons are not doing it, but here's a good example. They have a posting, and they're going to attract medical students who are young and connected, and they will look at this and say, oh, wow, I'm going to apply to UC Davis because look, they're speaking to me here. And then they have outreach to the community for this town hall, and they post this and they hold this forum, and it has nothing to do with cardiothoracic surgery, but they're really providing a community effort to get everyone involved. And then they use this to search for talent for PAs and nurse practitioners. And then they also, are not shy about sharing the fact that they're the #1 hospital system in Sacramento. They're also championing a cause for Lung Cancer Awareness Month. And look at this, they have 1,700 likes and 500 people that are checking in. So I thought that was really interesting. So I hired a marketing company to help me manage my social media presence, because I had no presence at all. And so I pay them a monthly fee, and they have set up my webpage, and twice a week, they will be posting something, and it will be a mix of different topics based on these 5 pillars. And we design the content a month in advance so that it's just on autopilot. I say, go with these 8 things, and then over the next month, it will be published. And it will be based on an educational platform where they might get a tip or some sort of championing other health topic like nutrition or exercise as it relates to spine health. It will also be a little bit interactive in that I may share a video, ask polls and answer questions. a little expositional with pictures and highlighting some unique aspects of my practice, communicating some of my values, and also involving the community with patient testimonials and championing other providers that I work with, physical therapists, acupuncturists, and then providing an entertainment value so that it's not all serious and that it's fun and it shows a more casual side to me and my staff. So here we go. This is my page. We went live this week, literally 2 days ago. So this is a shameless plug for you all to go and like me. I don't know, befriend me. I'm not sure that the right words. And then here's my Twitter. Okay, look, zero following, 0 followers. And this is my first post. There you go. So here we go. Online reviews are here to stay. You need to focus on patient experience, take control of your online reputation, claim your business on the various review sites. All you have to do is click or have someone click and respond to your reviews. You could have a manager respond to your reviews. You don't have to be the one doing it. And manage your social media, website, Facebook, Instagram, Twitter. Thank you.